Shelby presented to us with pretty typical presentation for symptomatic varicose veins. She had large anterior accessory veins on both thighs.
In the summertime, when I'd want to go wear shorts and I'm going to be around people that I don't really know, I get embarrassed and I want to hide my insecurity. So I would wear pants or leggings and I'm hot and uncomfortable. It's embarrassing really to have something that people my age generally don't have, and people look at you and question you, and it's embarrassing. It started in the middle of my thigh and just branched up and down. It looked like a road map was going down my leg. Big blue road map. I work as a bartender at night, a couple nights a week. By the end of the night, on your feet for 9 or 10 hours, my hips would hurt, my ankles would swell. It would feel like parts of my leg fell asleep. And then at some points it felt like someone was pushing on a bruise. I would roll it out or stretch, go to the back and try to elevate my leg a little bit, sit down if I could, if we weren't too busy. But sometimes you just gotta work through it and it's really uncomfortable.
We began by treating her left leg, where we did a radiofrequency ablation to close down the refluxing blood that actually caused the vein in the first place. That's a very simple 8 to 9 minute procedure that we do, which we close down a vein where the blood is actually going in the wrong direction. We do that in a minimally invasive way in the office with a radiofrequency ablation.
He walked me through the process and he told me what we would have to do for the different types of veins, because along with the big vein that I had running down my left leg, I also had small spider veins too. He told me all the different procedures we were going to be doing and explained to me that I'd have to come back a couple different times. He said that my outcome would be great.
The one on her left leg was particularly large and very symptomatic. She worked as a bartender and spent many hours on her feet and was having difficulty completing her work due to the symptomatic varicosities.
Before, the vein was so big that I would have strangers asking me about, what is that? Why do you have that? Where did that come from? And it's embarrassing.
So the nice thing about the minimally invasive procedures, whether it's a microphobectomy or radiofrequency ablation or EVLT, is that there's really no recovery. You can pretty much go back to your normal activities, whether that's going to the gym or taking a walk or even going back to work the same day. There's very minimal symptoms after the procedure, and it's almost unheard of that anybody would need any type of pain medication or even ibuprofen after the procedure.
And now I can go to the gym in shorts, or I can go to the beach and no one notices. I have one little mark on my leg and it looks like a bug bite. You can't tell that I ever had a vein.
The other nice thing is there's really almost a 0% complication rate. The only real complication that you can see on a regular basis is just some mild bruising and some areas of mild tenderness after the procedures. This is kind of what we would expect 3 weeks after a radiofrequency ablation procedure and a phlebectomy. You can see there's still some marks where we had done the phlebectomy and actually removed the vein. These are typical scars that usually go away within a month or two. And then the area where we had done the radiofrequency ablation on the inside of the leg, there's no evidence that any procedure at all was even done there. So this is a good outcome cosmetically too. You pretty much can't see the vein anymore at all.
And now that I have my procedure done, my hips don't hurt nearly as bad as they used to. It's gotten a lot better and my ankles don't swell up anymore, so that's really great.
We try to streamline the process in order to minimize disruption to the patient's lifestyle. The best aspect of the radiofrequency ablation procedure is there's excellent clinical and cosmetic result with minimal discomfort.